Hello everyone, my name is Lucia Bravo and I am a researcher at the Pathology and Tissue Engineering Research Group at the University of Valencia and the Cliva Biomedical Research Institute. I would first like to thank the organizers of this conference for the opportunity to share our work here. And today I'm pleased to present our study titled Cancer Epithelial Cells Participate in the Self-Organization of Lung Tumor Spheroids, a morphological approach. So this research explores the intersection between material science, specifically bioscaffolds, and cancer biology, focusing on how the structural organization of lung tumor is driven by a complex dialogue between different cell types. So, to provide some context, lung cancer remains a global health emergency. According to recent data, it is one of the most diagnosed cancers at the leading cause of cancer-related mortality, accounting for approximately 1.8 million deaths annually, which represents 20% of all cancer deaths worldwide. Within lung cancer, non-small cell lung cancer is the most prevalent type, comprising about 85% of cases. Traditionally, we have blamed genetic mutations for the high metastatic capacity and drug resistance of these tumors. However, mutations alone do not tell the whole story. We must look at the tumor microenvironment. So, the tumor microenvironment is a highly heterogeneous and dynamic architecture. It is composed of tumor epithelial cells, but also vascularization, immune cells, cancer-associated fibroblasts, also called CAFs, all embedded in an extracellular matrix where type 1 collagen is the most abundant component. A critical process occurring within this microenvironment is the epithelial-to-mesenchymal transition. In this process, epithelial cells lose their polarity and cell-to-cell adhesion, gaining the motility and invasiveness characteristic of mesenchymal cells, which is essential for tumor dissemination. The major limitation in our field has been the lack of models that faithfully reproduce the tumor microenvironment. Traditional genetic culture models fail because they cannot replicate the complex cell-cell matrix and cell-cell interactions found in vivo. And animal models, while useful, also have translational limitations. Therefore, there is an urgent need for 3D in vitro models that allow us to control the elements of the extracellular matrix and study the interactions between different cell populations in a way that is compatible with precision medicine. So our goal was to investigate how epithelial and stromal cells collaborate in growth, reorganization, and dissemination through a type 1 collagen scaffold. Our methodology followed a rigorous process to reveal the tumor architecture. We used two human non-small cell lung cancer cell lines. The first one, H460, a large cell carcinoma line, and the second one, H1792, an adenocarcinoma line. The stromal cells, CAFs, and normal fibroblasts were isolated from lung adenocarcinoma patients undergoing surgery. So, to form the spheroids, we used the hanging drop method, and we created different combinations: pure tumor cells or tumor cells mixed with 50% or 70% of stromal cells. After 72 hours, these spheroids were embedded in a type 1 collagen hydrogel, and we didn't just look at them. So we analyzed them using a multi-scale approach. First one, phase contrast microscopy for daily morphological monitoring. Second one, confocal microscopy for 3D reconstruction and protein distribution using F18 and pankeratin. The third one is transmission electron microscopy for ultrastructural details at the organelle level. And the fourth one, RT-PCR, to quantify the expression of EMT or epithelial-to-mesenchymal transition markers like CDH1, CDH2, or BMT. So let's dive into the results. And our first observation was the epithelial cell type fundamentally dictates the spheroid's initial organization. H460 cells formed highly cohesive and compact structures. When we added normal fibroblasts or CAFs, we saw two different things. The first one, an increase in size, and the second one, the appearance of branching. With 70% CAFs, the branches was significantly more aggressive than with normal fibroblasts. So in the case of H1792 cells, however, show a completely different behavior. They didn't form compact cores, instead they form dispersed cell clusters that tended to branch through the collagen immediately. When we add stromal cells, this dispersion became so profuse that by day 7, and the branches occupied almost the entire scaffold, making it impossible to measure individual areas. Quantitatively, the spheroid area for H460 significantly increased in the presence of CAFs, especially in the 70% proportion, showing a clear dose-dependent effect of the stroma or tumor expansion. Okay, so to understand how they were moving, we use fluorescent staining for F18 in red and pankeratin showing green. In the H460 line, pure spheroids remain as cohesive multi-layer sheets, but in co-culture we discover another thing. We discover a collaborative migration pattern. As you can see in the image, we found invasive branches where the leading edge was composed of pankeratin-negative fibroblasts. These fibroblasts appear to act as scouts or pathfinders, navigating the matrix and filling the cohesive pankeratin-positive epithelial cells behind them. So in this image, you can see the process explained. In the H1792 line, the cells tend to form epithelial layers or thin profuse branches. But in co-cultures with 70% of stromal cells, the organization was even more striking. So we can observe large epithelial lamines and very long dispersed branches interspersed with fibroblasts showing long cell extensions. This pattern is actually quite similar to the butterfly wings configuration seen in adenocarcinomas in situ, where cancer cells grow along alveolar septa. Our morphometric data back up these visual findings with statistical significance. For example, in the case of H460 spheroids, the addition of 70% CAFs led to a significant increase in the spheroid area and core area, in the number of branches and the branch area, and in the maximal length of level 1 branches, which reach over 200 micrometers in CAF cultures compared to almost zero in pure H460 spheroids. Interestingly, the thickness of the branches did not change significantly, suggesting that the stroma promotes the length and quantity of invasion rather than the bulk of the invasive font. This is where the study gets even more detailed using transmission electron microscopy, and in pure H460 spheroids, the cells were attached by clear junctional complex, shown here by this red arrow. But when we introduce fibroblasts, natural fibroblasts or cups, the cells develop a clear secretory phenotype. So we can observe well-developed Golgi apparatus and abundant rough endoplasmic reticulum indicating high protein synthesis. We can also observe abundant deposit of newly secreted extracellular matrix. In calf culture, we even saw newly secreted collagen fibers organized in parallel to the cellular processes, suggesting that the cells are actively remodeling their own environment to facilitate migration. And we can observe too the presence of cabello in the plasma membranes. These are multifunctional structures linked to mechanical tension buffering and tumor signaling, and their presence is a strong marker of cellular physiopathology in cancer. And to provide molecular validation for these morphological changes, we look at the expression of epithelial-to-mesenchymal transition markers. So we found what we call the molecular seesaw, because CDH1, the gene of eukaryotic protein, which is the glue that keeps epithelial cells together, plummeted almost to zero in all co-culture conditions. Conversely, CDH2, the gene of encadering protein, and pimentin, both markers of a mobile mesenchymal phenotype, increased significantly. This shift was most dramatic in the 70% stromal cell groups, so this confirms that the physical branching and invasion we saw the microscope are driven by the activation of epithelial-to-mesenchymal transition program triggered by the stromal cells. And why does this matter for material science and nanotechnology? Because the speed of the process is crucial for clinical applicability. While other research groups report model establishment times of 4 weeks, our biomimetic collagen scaffold generates fully organized tumor avatars in just 1 week. This 7-day window from patient biopsy to drug screening is compatible with clinical timelines, so we can extract primary cuffs and epithelial cells on day 1, let them self-organize by day 4, and have a physiological accurate model ready for the pharmacological screening by day 7. So this allows doctors to test which drug works best on a specific patient tumor architecture before starting treatment, fulfilling the promise of precision medicine. And to wrap up, our study leads to 4 main conclusions. The first one is that the epithelial tumor subtype H460 versus H1792 strongly influences the initial pattern of organization and migration. The second one is that stromal cells, particularly CAS, are key organizers that promote growth, branching, and a secretory phenotype. The third one is that CAFs act as a leader in a collective cell migration, remodeling the extracellular matrix to facilitate invasion. And these interactions trigger two epithelial-to-mesenchymal transition process as proven by the molecular shift from CDH1 to CDH2 and pimentin. So to take home message is that our 3D model, effectively reproduce key interactions of the tumor microenvironment and represent a promising rapid platform for personalized drug screening in lung cancer. So I would like to thank my co-authors and the funders, and overall, thank you very much for your attention. And now I am open to any questions you may have.